Hello, I'm Dr. Dehra McGuire. I'm a laryngologist here at Warren Clinic ENT. And if you're coming to see me, you're probably seeing me for a voice, airway, swallowing, cough problem, something to do with your throat. And so I just wanted to say hello and introduce myself and to kind of prepare you for the kind of things that will happen during your visit with me. The throat is hard to see through the mouth, the area that we need to look at. And so I do a procedure in clinic called flexible laryngoscopy, where I do put a camera into your nose to get a good look at everything that's going on down there. And I just want you to be prepared before you come that you're gonna have a small procedure done while you're here. And I have a lovely assistant. Oh, this is Maddie, my medical assistant. Just so you can see that this is not a big deal, it's very tolerable, and I do it to 15 to 20 people every single day here in clinic. Everyone survives. So I just want to give you a quick example of what that looks like today. So as long as there is not a contraindication, you have no allergies to it or anything like that, we will spray some Afrin and lidocaine in the nose to help decongest you and to help numb your nose up so that you don't feel the camera as much as if you were unable, or if you were able to feel kind of everything. And so this feels a little funny. It's like a little blast of liquid going into your nose. It's a little bit loud. A little spray here. You taste it. I'll do a little more. No. All right. A little bit more. There we go. There we go. All right. Okay. I'm going to add a little microphone here. This is something that I do that's unique to laryngology, is stroboscopy. And so this microphone helps capture your voice and helps shine a light so that I can see your vocal cords in slow motion to really get into the fine details of why you may be hoarse or having other problems with your throat. All right. This is my long skinny camera. It is not scary. I only put about this much of it actually into the nose. The rest of it is just giving me room to work, so I'm not right up on you as I do the procedure. And I always coat it in a little bit of slippery stuff to make it glide through the nose as easily as possible. What I'm gonna do is I'm gonna look on either side of your nose. I'm gonna pick whichever side looks the most open, and that's the side I'm gonna choose to slide the camera all the way back on. We only have to go down on one side, so it's not something you have to tolerate on either one. The nose goes back to your throat and it's one big open cavity, so you only have to do it once. All right, so your job is to relax, keep your shoulders down, keep your mouth closed in the beginning, and just breathe in and out through your nostrils. I'm gonna look on the left side first and see. Not too bad. Let's take a look at the right side and see. Okay, so this is your more open side. So this is the side we're gonna slide the camera back on. So you're gonna feel some pressure. It feels kind of like you have to sneeze sometimes. It's just really important that you stay nice and still. And now we're in the nose and I can see the back of the throat. I see the back of the tongue and I see the vocal cords. And go ahead and hold out the letter E for me. E. Amazing. And breathe. All right, and now I want you to say E and I want you to sniff. And between each one, do it 5 times. So E, E, E. E. Perfect. And how much do you feel that camera?
Not really.
Yeah. Would you say that this is painful for you?
No.
Excellent. All right. I'm going to come out. So it only takes me about 1.5 minutes to do everything we need to do. And then we're done.
That was not bad.
Not as bad as I thought it was going to be. That's my goal every single time. Not bad. All right. There you go. So if procedures being done in clinic is something that makes you a little bit anxious, you're welcome to bring a support person with you. You can hold their hand. Sometimes Maddie will hold your hand if you need to. But we really want to make this a comfortable process for you because this is something that I do very frequently, repeatedly to my patients to make sure they're making progress. So our goal is for it to be as not traumatic as possible. So feel free to bring a buddy.